Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, dear student, to your orthodontic Google Classroom. With you, your lecturer, Dr. Lamis Khader Muhammad, orthodontist at the POP Department, College of Dentistry, Babylon University. Today, I will give for you lecture 6 of your syllabus, and it will be about the orthodontic appliances. In the previous lectures, we explained for you the orthodontic tooth movement types, theory of it, and biological response. Today we will talking and take talking about the appliances that can create these tooth movement or induce these types of tooth movements. So let us begin our lecture. The orthodontic appliances generally have many types. It can be classified according to its mode of action and its type of attachment into 3 to 4 types. The first one is the removable appliance, which are very important for you in this year, and you will deal with it in this year and inshallah in the next year. And the second type is called functional appliances, which can do skeletal modification, act on the bone and muscles. And the third type is the fixed appliance with a fixed braces. And the fourth type is use a combination of both fixed and removable appliances. As I mentioned for you, we will talking today about the removable appliance, as it is the most important for you in this under classes in this stage of fourth and fifth stage of your college. So what I meaning by removable appliance? I can define the removable appliance simply as a appliance that can be removed by the patient for cleaning and washing. This type of removable appliance, it can apply force to the teeth by stainless steel wires or springs, or sometimes can apply this force to the teeth by using of screw or any other mechanical component like screw or elastic. The removable appliance can be on 2 types. According to what? According to its ability to give us a force or not. If it give a force and created a tooth movement, it will called active removable appliance. Or if cannot give us a force, so it will called a passive removable appliance. So what I mean by each one? The active removable appliance, it's mean the removable appliance that can produce tooth movement by the springs, screw, or elastics. While, like this case, you can see here, this removable appliance have 2 active components. This is called a modified buccal canine retractor, sleeve type, and finger spring footed here is also active component. Or passive removable appliance, which means it is a removable appliance that have no active component, or it will not create any force and any tooth movement. No tooth movement will be obtained by this type of removable appliance. Like what? Like the retainer that consists only from Adam clasps, Howley arch, and acrylic base plate. It is used as appliance to keep the tooth after the end of correction of the malalignment of tooth with a removable appliance active type, or with fixed appliance we get or reach to the retentive or retention phase of orthodontic treatment. In this stage we need for appliance to keep the teeth in its new position. This appliance is passive removable appliance called retainer. Other passive removable appliance like habit breaker, which is the appliance used to break any bad oral habit like thumb sucking, tongue thrusting, or etc. The other passive removable appliance that not create tooth movement or a force is called a space maintainer, that use to keep the teeth in its places and prevent the drifting of the teeth in the extraction side after the early exfoliation of the primary teeth. I mean, when we have a early extraction or early exfoliation of primary teeth, we need to keep the space for the permanent tooth. So we need a space maintainer that keep this space for the permanent tooth when it will be erupted in its eruption time, and prevent the drifting of the present teeth in this extracted space, and keep this space as a whole. The removable appliance, whether it was passive or active, it will be made from the following materials. It is made from acrylic, stainless steel wire, and others like screw or elastic. So these are simply the materials that is the removable appliance made from it. Now, the removable appliance, the action of it, what I meaning by the action of removable appliance? I mean, what are the type of tooth movement that can produce by removable appliance? If you remember or not, I will make a refresh for your memory. I previously said for you that we have 6 types of orthodontic tooth movement. Tipping movement, and we have bodily movement, extrusion, intrusion, rotation, and root movement. So now the question is, which type of tooth movement we can create it or produce by using a removable appliance? The removable appliance can produce only tipping movement and rotation movement in less than 90 degrees. Only these two movements we can do by using a removable appliance. The tipping movement, it will be either in labial direction or buccal direction, like this tooth in standing cross-bite, or this tilting teeth, we can or need to move it in mesial and distal direction. So either labial movement or lingual movement or mesial or distal movement. And the rotation movement, which is less than 90 degree when we use a couple force system. So these are two types of tooth movement that can use or produced by removable appliance. Now, everything in our life, everything have a good effect and side effect, advantages and disadvantages. So this will be also for the removable appliance. The removable appliance also will have advantages and disadvantages if we compare to the other types of orthodontic appliances. So what are the advantage of removable appliance? Firstly, the removable appliance can be removed. Yes, it can be removed by the patient. Whenever the patient wants to remove it, they can remove it from their mouth. And this represented advantage for removable appliances, especially in social sensitive occasion, not like the fixed appliance, which are fixed to the teeth. Second advantage, it's about the chair time. The removable appliance will take short chair time from the orthodontist or from the dentist. Why? Because it will be fabricated in the lab. We just need to insert inside the patient mouth. So it will not need a long time. 3. It is a cheap. Yes, somewhat the removable appliance is cheap if we compare with the fixed appliance. Why? Because as I mentioned previous, it is made from simple materials, acrylic, stainless steel wire. Sometimes we put it as a screw or not, but however, it is represented a cheap material. So generally, it is a cheap. Simple. Yes, the removable appliance is simple. What I mean by it is simple, I mean that the removable appliance can be done and used by all the practitioner dentists or GB dentists, not specific only for the orthodontist or only for specialists. No, all dentists can use removable appliance for their patients. So it is a simple. Other advantage of removable appliance, it is the keeping of good oral hygiene. Why? Because the patient can remove it, cleaning their teeth easily, cleaning their appliance also, and wear it so it will keep the oral hygiene good for most of patients. These are these are the advantage of removable appliance. What about the disadvantage of it? The disadvantage, the first one is the cooperation. What I mean by it? I mean the tooth movement that I hope to do by using removable appliance, absolutely it depends mainly on the cooperation of the patient. Because if the patient not wear the appliance, that means no tooth movement will occur if the patient not wear the appliance for a time more than the duration threshold that I need to induce the tooth movement. Second, complex tooth movement cannot be created by removable appliance. I mean, the removable appliance unable to give me a complex tooth movement. I can't get a torque movement by removable appliance. I can't take or induce or create or producing a bodily movement by removable appliance. No, I can't. I only can produce the tipping movement and simple rotation. So this represented a disadvantage. Other disadvantage is that the removable appliance can move only few teeth on one time. One, two, three, no more. Not like the fixed appliance. I can do a multiple tooth movement, multiple types of tooth movement for multiple teeth at the same time. The removable appliance also, because it sometimes will become bulky, so it will become uncomfortable for the patient, especially during the first days of it, because it will be effect on their speaking ability. So these are summarily summarized for the advantage and disadvantage of removable appliance. Now, the components of removable appliance. So please, I want your attention to this subject. What about the components of removable appliance? Keep in your mind that the removable appliance consists of four important components. Four important components should be right and mentioned in the following sequence. The first component is active component. The second component is retentive component. The third component is the acrylic base plate. The fourth component is anchorage. The active component, it is the component that will give us a force and produce movement, like the spring in this design, modified buccal canine retraction, and finger spring here. So when I asking you or lecturer asking you to give us the design for removable appliance, you should mention one active component. In front of the active component, you should write this spring on the, for example, for this case, I mean, this spring on the upper left lateral. Modified buccal canine retractor on the upper left canine. Finger spring on the upper left second premolar. The retentive components, in this case, it is include Adam clasp on the upper left, left and right, first molar, upper sixes. 3. Acrylic base plates, which is represented the major connector that will connect all the components of the appliances. The anchorage, the fourth component, it is an imaginary component that need to resist the unwanted tooth movement. In addition to the active component in this design that includes the spring, modified buccal canine retractor, and finger spring, also there is a jack screw here, which is active component here used to do a transverse expansion in the maxillary arch. So these are the components of removable appliance generally. Active component, retentive component, acrylic base plate, and anchorage. I repeat it because it is a very important subject for you. Now, today in our lecture, we will talking about the active component, and lecture of the next week, inshallah, we will talking about the other component, I mean the retentive, acrylic base plate, and the anchorage. But today we're talking only about the active components. So the active component of removable appliance can be classified according to the direction of the force and the direction of tooth movement into labial or buccal movement, like what? Like the spring, recurved the spring, T-spring. Second, active component that can give us a palatal or lingual movement or force in palatal or lingual direction, like Howley arch, robot retractor. Third type of active component that can give us a mesial or distal movement or force in mesial or distal direction, like the finger spring or buccal canine retractor, whether it was simple or modified. The fourth component that can give us active component, can give us a direction of force or type of force or direction of force in different direction, like the jack screw or elastic. It will give us a force in different direction according to the position where I will put it inside the removable appliance. So we will talking about each one of it. Z, recurve, T, Howley, Robert, finger, buccal canine, jack screw, and elastic. Let us start with the spring. The spring is called the spring because it's look like a Z letter. The spring is located palatally. You take this spring, of course, in your lab and you do your work with it. So we explain all this information for you. So I will explain it briefly. The direction of force of the spring, it is a palatal labial direction. So it will give us a force in labial direction or labial tooth movement in labial movement. This spring generally is made of a zero point 0.5 hard stainless steel wire, and it is mainly used for the uses of it. It is used for the correction of a tooth in crossbite, single tooth in crossbite, anterior crossbite, and like these cases. In this case, the removable appliance consists the component of its active component, the spring, retentive component, Adam clasp on the upper sixes, and Howley arch that will give us slightly anterior retention and keep the tooth within the line of occlusion after its correction. 3. Acrylic base plate, the major connector, plus the modification of it, which is a posterior bite plane, put it on the occlusal surface of the teeth to open the bite anteriorly and prevent any interference with the labial movement of the central incisor. 4. The anchorage that will get from the retentive component plus the full coverage of the acrylic base plate that touch all the teeth. In this appliance, or in this case, the active component is the spring that will give us a labial movement, Adam clasp on the upper left right 6 and upper left right D, acrylic base plate plus posterior bite plane, also to prevent any interference, to open the bite anteriorly and to prevent any interference with the correction of or labial movement of the upper lateral incisor. The anchorage that will get from the retentive component, clasp, and the full coverage of the acrylic. The second use of the spring is with a correction of rotation less than 90 degree. When we have a rotated tooth, like this case, less than 90 degree, I will need for two force equal in amount, opposite in its direction, that apply on the mesial side and distal side. I need here to correct the rotation of this tooth, a force applied on the mesial side of the central incisor directed labially, and a force applied on the distal side of the central directed palatally. This spring will give us the labial movement or force in labial direction on the mesial side, and the Hawley arch will give us a force on the distal side directed palatally. So these two forces, which are equal in amount, opposite in direction, will correct the rotation by the couple force system. The other component that give us a labial movement or force in labial direction is the recurved Z spring, which are a two Z spring joined in the midline to each other to give us this recurved Z spring. It is generally also like the Z springs made from a 0.5 millimeter hard stainless steel wire located palatally, give us a labial movement. It can use also correction of crossbite and correction of rotation less than 90 degree. But when we have more than one tooth in crossbite or in rotation, maybe for two central incisor, three incisor, four incisors, I will use the recurved Z spring. Now, the other component is the T spring. The T spring, it will look like a T letter, and it will be located buccally or it located palatally, like the spring recurves the spring. It is made from gauge of wire of its 0.5 or 0.6 millimeter hard stainless steel wire. The uses of T-spring, it is, you can see in the picture, used for the buccal movement of the tooth, of the posterior tooth, or movement of one single tooth in buccal direction, like the premolars. Now, before I will talking about the active component that give us a palatal movement or force in palatal direction, I should explain for you this subject of rotation, which are very important for you. We have two types of rotation, this and this. This rotation is called mesial rotation. This rotation is called distal rotation. What are the difference between them? As I explained previously, if I want to correct the rotation by removable appliance, I need two force, I need two force equal in amount, opposite in direction, like the Z spring and Hawley arch. But here, when we have a mesial direction, what I will need to put as active component a removable appliance, I will need to put a recurve Z spring. I will need to put, Z spring on this central incisors with non-traumatic end located on the mesial side of the tooth that will give us a force directed labially on the mesial side. And I need a Hawley arch that come to touch the most prominent point of the tooth, which is the distal side of the tooth, and the Hawley arch will give us a force directed palatally. So by this I will correct this rotation. In the distally rotated tooth type, like this case, I also will need the spring plus Hawley arch. But here, I will put it as a spring with non-traumatic and located on the distal side of the tooth in order to move the distal side that is directed palatally to move in labial direction. And the Hawley arch that come to touch the most prominent point of the mesial side of the tooth, it will give me a force on the mesial side of tooth in palatal direction and move the tooth at the mesial side palatally. And by these two forces, I will correct the distally rotated central incisor. Now, what happens when we have a two teeth in rotation instead of one tooth? Of course, we will use a recurved Z spring instead of Z spring. This is the answer of most of you. No, I need to use a recurved Z spring in some cases of two rotation tooth or two rotation teeth, and in other cases I need to use two Z spring instead of recurved Z spring. What are the difference between them? This type of rotation in upper central incisor is called mesially rotated central incisors, while this case in this picture it is called distally rotated central incisors. In the first one, in order to correct this mesially rotated, I need a recurved spring that will be applied a force on the mesial sides of the central incisors in a force directed labially, and the Hawley arch that come to touch the distal sides of the central incisor will move this distal side and this distal side in palatal direction. So, in mesially rotated teeth, I will put a recurved spring plus Hawley arch, while in distally rotated teeth, I need for two the spring instead of recurve the spring. I need to put here this spring with non-traumatic and located on the distal side of the central incisors in order to move the distal side of the central incisor in labial direction, while the Hawley arch that come to touch the most prominent point of the teeth, which are the mesial sides of the central incisors, you can see here in the picture, it will give us a force on these sides, which are the most prominent point in palatal direction. So, with distally rotated central incisors, I need to use a two the springs with non-traumatic and located on the distal side instead with a Hawley arch located labially to give us a couple force system and correct the rotation. instead of use a recurved the spring. So we prefer to use to the spring instead of a recurved Z spring. So I hope this is clear for you because it is a very important to know it. Now, what about the component that give us a palatal movement or give us a force in palatal direction? As I mentioned previous, we have Hawley arch and we have Robert's retractor. The Hawley arch is generally made from 0.7 mm hard stainless steel wire. It will be located labially situated. You can see here. It's come to touch the most prominent tooth or the most prominent point of the tooth. This type, it's used for, the Hawley arch, which is consist of labial arch and U-loop located here on the canine and two tags. It is used for as active components for retraction of the upper incisor teeth when the overjet less than 6 mm. Or the other uses of Hawley arch is for a couple force system or as active component also, and the other use is the retention, like the when we use in passive removable appliance in the retainer. The Robert retractor, it is also situated labially, like the Hawley arch. It is made or consists from labial arch and two sleeve buccal canine retractor on each side. Or generally in other explain, it is consist of two sleeve buccal canine retractor join at the midline and form this Robert retractor. It is either made from a 0.5 mm hard stainless steel wire, include the labial arch and the mesial arm coil, and the distal arm will be sleeve type in order to give us a vertical and horizontal stability for the Robert retractor. Or generally it will be made as a whole from 0.7 mm hard stainless steel wire, include the labial arch, mesial arm, coil, and distal arm and the tag. The Robert retractor will be used for retraction of upper incisor teeth or incisors when the overjet is more than 6 mm, and also it will be used in the retraction of upper incisor in stage 2 of the treatment of a class 2 diff 1. The third active component that give us a mesial or distal force direction or mesial or distal movement is include finger spring, whether it was simple or guarded, and buccal canine retractor, whether it was simple buccal canine retractor or modified buccal canine retractor. The simple spring, finger spring, you took it in your lab and you work it with the simple and guarded finger spring. The simple spring is made of 0.6 mm hard stainless steel wire. It is located palatally, while the guarded located palatally and made from 0.5 mm hard stainless steel wire. The finger spring, whether it was simple or guarded, it will be used for movement, mesial or distal movement for any tooth, whether central, lateral, canine, 4, 5, 6, any tooth in mesial direction or in distal direction. But when the tooth located within the line of the arch. The most use of finger spring is for distal movement of canines. The most important things for the finger spring to keep it in your mind is the coil of the finger spring should be located opposite to the direction of tooth movement. And the activation of the finger spring, it will be by opening the coil. While the activation of recurved this spring and this spring, it will be by closing the coil. Now, what about the buccal canine retractor? We have two types of buccal canine retractor. It is generally both of them, whether it was simple or modified buccal canine retractor, both of them is located buccally. It is made the gauge of wire of it is 0.7 mm hard stainless steel wire. The simple one, this is the shape of the simple buccal canine retractor, consists of non-traumatic end, mesial arm, coil, and distal arm and tag. While the modified buccal canine retractor, it is consists of C-clasp with non-traumatic end or without, mesial arm, coil, distal arm, and tag. The simple buccal canine retractor, I mean this one,